Joining us here at the 2011 ONS conference in Boston, Massachusetts is Jerry Gorospe, Clinical Nurse Manager at City of Hope Hematology in Duarte, California. Jerry, thanks for stopping by and spending some time with us.
I'm delighted to be here.
Let's talk about what your poster presentation was and what its purpose was.
The title is A Durable Response of Nilotinib with a patient with chronic myelogenous leukemia in chronic phase. And this is the 18-month result of the NS&D study, which was conducted as a multi-center international that looked at the response of nilotinib to a newly diagnosed population in comparison to the imatinib, which has been the hallmark drug currently being used for newly diagnosed CML patients. With this medication, with this clinical trial, the FDA granted the Novartis Corporation to receive first-line indication for nilotinib, 300 milligrams twice daily dosing. And so I'm reporting on this poster is the efficacy of the medication, nilotinib, in the 300 dose and the 400 dose versus the imatinib 400 milligram dose twice daily. And also the durable response that we're having so far at 18 months.
What were the endpoints for this trial?
We looked at the endpoints for the major molecular response of the medication, because it's known that nilotinib has a great response and a molecular response. And also the second point is the complete cytogenetic response of the medication with response to the patient's response to.
Jerry, what does the safety data look like?
The safety data, in comparison to imatinib, they both have different data as far as adverse events. The toxicity that we're experienced with, mostly with nilotinib, is more significant with the rash. However, they were not a grade 3; they were manageable rash that we're able to treat easily. And in comparison to imatinib, most of the toxicity that were experienced were mostly nausea, the vomiting, that were also treated easily. However, these are toxicities that some patients aren't able to tolerate, and so they will need to be on a different type of medication, and hence that's where nilotinib would be able to take over. And so if it's a patient who's known to have more significant nausea and vomiting, then you would probably want to start the patient in nilotinib versus imatinib.
Overall, what are the recommendations for oncology nurses?
For oncology nurses, I think the real understanding of what molecular response is and what a cytogenetic response in regards to what the study was following up, and really having a good understanding of what the adverse events that were experienced against the two medications, so that they can really have that degree of understanding and be able to educate their patient about what to expect with the two types of medication, imatinib versus the nilotinib, and also that the nilotinib now is a second choice, or rather it could be a first or second choice for them to prescribe for the patients for first-line CML chronic phase, which is the nilotinib 300 milligrams PO/BID, which was FDA approved recently.
Jerry, thanks for explaining your abstract to us and spending some time with us here at ONS.
I appreciate being here, and thank you for your time.
Good job. Jerry Gorospe, Clinical Nurse Manager at City of Hope in Duarte, California.